I don't give these type of presentations a ton, so bear with me, but I do talk a lot, so it usually is pretty good when you're doing a presentation. So I'm going to talk primarily about the overall oral health of kids with 1p36 deletion syndrome, but in general, kids in general with special needs. But also, most of the stuff I'm going to talk about will apply to your own mouths. So everybody has teeth, everybody has a mouth, everybody has dental problems. So a lot of this stuff will, it'll apply to all of us. So a little bit about me, you've heard already. I'm Ken Shirtcliff. I have my wonderful family, my wife Carmela, which has been helping with the conference and bears with me and all the stuff that I do. And then I have my younger son Luke, who is 9, Joseph, who is 12, who has 1p36 deletion syndrome, and Gabriella, who helps take care of Joseph a lot of the times, and she's 14 and will be a freshman next year. I'm, as you know too, president of the organization and have been for quite some time. And I've been practicing dentistry for about 19 years in Bend, Oregon. And if everybody wonder where Bend, Oregon is, it is in the middle of the state pretty much. So if Oregon's kind of a square, it's kind of in the middle right in there. And we've been in the news lately because we have the last and only Blockbuster store in the country. I didn't realize there weren't very many Blockbusters because I drive by that one every day almost. And so I just thought everybody had Blockbusters like we do. Apparently not. There used to be 9,000 of them. Now there's one. And that's where we live. And it's not like a teeny town. It's, I don't know, we're 100,000 people probably. So when it comes to teeth and the mouth and 1p36 deletion syndrome, there's not a lot in the literature about what happens. But the main thing that all of our kids almost all have is mid-face hypoplasia, which basically, if you look at all your kids, your maxilla is the top part of the jaw. So right at this face, underneath your nose, kind of the nose area, and in the front. Your mandible is the chin. So if you look at all the kids, a lot of them have underdevelopment of the maxilla, so that upper bone right here. And it makes a lot of the kids look like they have an underbite, and it can create an underbite where they're like this, or at least end to end where their teeth are lining up right, the incisors, the edges of the teeth kind of touch, or the bottom teeth will be further forward. Sometimes the teeth line up okay, but the chin looks more pronounced. There we go, thank you. The chin looks more pronounced because the middle of the face is not growing at the same rate. And that'll happen with a lot of people, but it definitely happens a lot in a ton of our kids. And it's kind of across the board. And if you look at all the kids, you'll notice they kind of have a flat looking face. And it's because that maxilla and that nose area does not grow the way it typically would. And so it can cause an underbite, it can cause a crossbite. A crossbite is where typically your top teeth overlap your bottom teeth. A crossbite is where it's opposite, where your bottom teeth overlap your top teeth, and that can be in the front, that can be in the back teeth. It can also cause crowding, so if you don't have as much growth of the upper jaw, then there's not as much room for those teeth to come in, and so a lot of times those teeth are going to be really tight together, or sometimes be stuck where they can't even come completely in. Another thing that's common or fairly common in 1p36 deletion syndrome is cleft palate, cleft lip. How many people have kids who had a cleft lip or cleft palate in this room? Yes, some in the back. The literature was like 5 to 17%. So, in some groups we'd see more, some groups we'd see less, but it's not a huge percentage. Cleft lip, cleft palate obviously can be surgically repaired. Which they're very good at doing. They've been doing it for a long time. But it can cause feeding issues as well, harder to suck, especially at the very beginning, because they try to repair them as quickly as they can, but cleft lip, cleft palate can cause some feeding issues. So in general, there are dental issues in people with special health care needs. Now, special health care needs is defined as, well, this is a definition from the American Academy of Pediatric Dentistry, which is any physical, developmental, mental, sensory, behavioral, cognitive or emotional impairment or limiting condition that requires a medical management, healthcare intervention, and or use of specialized services or programs. So obviously all of our kids are going to fall under that category. So the reasons why this typically happens is so individuals with those different issues just have a hard time to assume the responsibility for and cooperate with preventative oral health practices. So, I mean, we know that our kids have a hard time either A, brushing their own teeth for sure, being responsible to brush their own teeth, or even cooperating with us to be able to brush their teeth. So the things that generally, the two main issues that people have in their mouth are either going to be caries, which are cavities. We call them caries, but cavities, holes in your teeth, or periodontal disease, also known as gum disease. They're two kind of separate things. I'll talk a little bit about those as we go on. So the causes of those things, both cavities and periodontal disease, are primarily plaque bacteria. So plaque is kind of a sticky film that forms on our teeth, forms in our mouth, that is primarily bacteria and kind of sugary compounds that create this sticky film. It's the stuff when you look in your teeth or you look in your child's teeth when you haven't brushed, it's kind of this gooey white, which if you haven't brushed for a long time, I always say it looks like sweaters on your teeth, which is kind of gross, but that's kind of what it looks like. Tartar, on the other hand, tartar also we call calculus, is a hard deposit that is on the teeth that you can't brush off anymore. And you'll see it and you can feel it. Some people grow a lot of tartar. Some people do not form quite as much. In our kids, it can be, so for some people, it's worse due to the chemistry of their saliva, where the chemicals in our saliva can calcify and harden that stuff more quickly than it would maybe with someone else. Kids or individuals who are tube-fed or people who have a softer diet, which is a lot of our kids, a lot of times will grow or form tartar a little bit more quickly. The reason being is when we chew and we eat, especially crunchy things, hard things, stuff like that, the action of chewing, the makeup of just the food kind of rubs the plaque and the tartar off of our teeth. So there's a little bit of a self-cleaning action when we chew things. And so if you are not chewing, or if you are not actually getting food in your mouth at all, maybe just water or thin liquids, but most everything is going in your stomach or going directly through a tube, then you're not chewing on things. Now you might chew on your hand, you might chew on a toy, you might chew on other things, but it's different than chewing food, and they're gonna build up tartar a little bit more. The other reason why it can, besides bacteria, is the crowding, which makes it harder to clean the teeth. So you're going to have bacteria that is able to get in places in your mouth that you can't clean. So what is plaque bacteria? I said a little bit, it's a sticky film. So it's a sticky, colorless film of bacteria and sugars that constantly forms on our teeth. So as soon as we brush our teeth, as soon as you brush your child's teeth, that bacteria, you're never going to eradicate all the bacteria in your mouth. You know, you hear the commercials for Listerine, kills 99.9% of all oral bacteria. Well, that's the stuff that the Listerine can touch. It might kill, but we can't kill all of it. But, so there's over 700 different strains of bacteria that have been detected in the human mouth. That's a lot of different types of bacteria. But most people have about 34 to 72 different kinds, and a lot of them are harmless. Some are actually good, that help protect our mouth. Just like we have good bacteria in our gut, we can also have bad bacteria in our gut. But some of the bacteria that's in our mouth is bad. And we're never going to eradicate all of it. And even if we could, we're also going to then kill off some of the good bacteria. In fact, if any of your kids have taken antibiotics when you're a child, you know, when you're little, or even some adults or elderly take antibiotics, and you end up with thrush. Well, thrush is candidiasis, which is because the antibiotics have just killed off some of the good bacteria. So now you have other bad things that start growing in the mouth. So there's this fine balance, this natural kind of oral flora, as we call it, that is going to be in the mouth. So we can't kill everything. We don't want to kill it all, but unfortunately, we've got to brush our teeth and we've got to keep the mouth clean. Otherwise, we're going to end up with dental issues. So some of the bacteria causes tooth decay. some of the bacteria causes gum disease. I'm going to focus a little bit more on the main bacteria that causes tooth decay, which is Streptococcus mutans. That's the bad one. That particular bacteria is generally known to be the main cause of tooth decay in our mouth. It eats the sugars and the starches and the carbohydrates in the foods that we eat. So when I eat an apple, or I drink orange juice, or I have a Coke, or I eat a potato chip, or whatever it may be, it doesn't matter if you think it's sugary or if you think it's not. The bacteria in our mouth, including Strep mutans, eats the things that we eat. And what it does is it eats that, and it creates an acid. So I tell people in my office that the bacteria in our mouths eats our food, and it poops acid on our teeth. So, a lot of times we think of bacteria having little tiny mouths, and when you look at like the cartoons and stuff that the kids see, and you got these bacteria, and they're like eating on the teeth. Bacteria don't have mouths. They don't actually have teeth. They don't eat on our teeth. But what they do is they create a really, really strong acid. And when that plaque is on our teeth, that acid starts to dissolve our teeth. So enamel's super hard, hardest structure in our body. But the acid is strong enough that it can start to dissolve our teeth. And if that acid sits there long enough, then it will create a hole. Now, long enough is really going to vary on a lot of different factors. So, if you didn't brush your teeth this morning, and maybe you don't brush it till tonight, and you're like, oh my goodness, I've got this acid on my teeth, I'm going to get a cavity just today because I forgot to brush this morning, that's probably not going to happen. But if it's there longer, or if you have that bacteria sits there for a period of time, and then you brush it off, but when it sits there for a while, and this is in your mouth, this is in your kid's mouth, it sits there and it creates that acid, and it weakens the outer surface of the tooth. And it microscopically weakens it because that enamel is really, really hard. So then we brush our teeth, and we hope that then that enamel rehardens. And I'll talk about ways here pretty soon that we can do things to help reharden that enamel. But that enamel gets slightly weak. So then if maybe the next time, maybe it's the next day and we didn't brush very well, or we missed an area, that enamel will get a little bit weaker. And it's this kind of weakening over time where we're leaving that acid behind. And that will cause the cavities and the decay. So what do we do to help keep our mouth and our children's mouth healthy? One, eat a healthy, balanced diet, and good oral hygiene. Well, what's wrong with those two things with our kids? Eating a healthy, balanced diet is really hard sometimes. We're like, oh yeah, fruits and vegetables and all this stuff, and well, some dietary restrictions. Some kids, especially when they're really young, the teeth come in quite early. Kids may get better at eating things as they get older, but those teeth are there from the very, really, really early. And good oral hygiene is also difficult, because they aren't going to brush their teeth. But and it's difficult for us to brush our kids' teeth. I recommend in my office for parents to brush their kids' teeth, and this is, let's just say, typically developing kids. I'm recommending you as a parent brush your child's teeth until, 7, 8, 9. My youngest is 9. I still brush his teeth most of the time. Of course, as a dentist, I do not want him to get a cavity. There's a really, really big reason I want to do that. But the example I always use for any kid or any parent that's brushing their child's teeth is if you had your child go out and say, hey, go wash the car. And let's even it was a small car. And they'd be out there, they'd get the hose and they'd get the soap and they'd be going crazy and man, they're doing a good job. And then you'd rinse it off and you'd let it dry. And some parts of the car would be clean. Great. A lot of parts of the car would be completely dirty. Heck, when I wash the car and I let it dry, I've missed a spot somewhere. So then you go back and you get it. Well, a kid, they miss a lot of spots. And if it's same thing with the toothbrush. They've got the toothbrush, they've got the water, they've got the toothpaste, suds are flying, they're brushing all over the place, and it's like, wow, they're really doing a good job. But they're missing a lot of spots. In general, our kids can't tie their shoes till they're quite a bit older. They can't brush their teeth. But with our kids with 1p36 deletion syndrome, it's that to kind of the extreme. And then when we try to brush our kids' teeth, they're fighting us and they're battling us, and I'll kind of go over that here pretty soon also. So, eating a healthy, balanced diet, in general, this is more for all of us, but again, a lot of these things are not super easy to do. You want nutrient-rich foods, a variety of different food groups. They're going to promote healthy teeth and gums. Fruits, vegetables, protein-rich foods, calcium-rich foods, whole grains, all those things help to grow nice, strong, healthy teeth. Another thing I'll talk about a little bit is fluoride. I'll touch on that here pretty soon. That can help make the teeth harder as well. But it's hard to get a good, healthy diet. We're going to try as hard as we can. There's only so much you're going to be able to do depending on your child. I mean, if they're tube fed, that's something that's maybe a little bit easier because you're giving them this manufactured food that they put all the ingredients they think you need into that food. But if you're orally fed, I mean, they might have macaroni and cheese and chips and juice and it just things that are maybe a lot more carbohydrate rich, which unfortunately is going to feed that bacteria even more. The other thing I'll touch on here, well, I'll get to that in a minute. I'm jumping ahead of myself a little bit. So good oral hygiene, it can be difficult. Ability to cooperate, like I talked about. They can't cooperate very well. They may want to, or they may be pretty good. And maybe even if they do cooperate, as caregivers, we may have a hard time actually brushing correctly. It's hard enough brushing our own mouth really well and doing what we should do. I mean, I won't make people raise their hand who's ever had a cavity in their life, but I'm sure everybody in this room, or most people, will say, yeah, I've had one, but not everybody. But we've never done a perfect job on our own mouth, and now we're asking ourselves to do a perfect job in our child's mouth, and they're fighting us along the way. So it can be difficult. So to brush your child's teeth, there's some techniques that can help. And one way is to get behind your child, pea-sized amount of toothpaste, center the brush, and it doesn't have to be very much. Especially our kids who are not able to maybe spit out the toothpaste. A small amount is good. It's okay if they swallow it. It's not going to hurt them. A lot of times I get asked, well, should I use toothpaste without fluoride when they're really young, or should I have fluoride in the toothpaste? Generally, I'm going to recommend using a fluoridated toothpaste, so fluoride in the toothpaste, which most have. You'd actually have to go out and search for toothpastes that you can find without fluoride if you were going to do that. So a small amount of toothpaste. You don't need very much. The reason we talk about fluoride in a small amount of toothpaste, fluoride in certain areas or in too much can cause what's called fluorosis. Mild fluorosis it looks slightly different on the teeth. It doesn't damage the teeth. The teeth are actually still very, very hard and strong. In many of your communities, you're going to have fluoride in the water. Where I live in Oregon, only about 20% of the water supply is fluoridated. We're kind of weird when it comes to fluoride because about 70% of the nation's water supply is fluoridated. So most places are going to have fluoridated water, but not everybody does. So if you have fluoridated water, then swallowing a bunch of toothpaste is a little bit more important not to do because you could get fluorosis. Where I live, I just never see it because we don't have fluoride in the water, and so I actually will prescribe additional fluoride that the child will take. So if you happen to live in an area, and again, I'm good in fluoride here and jumping ahead, but if you live in a community that doesn't have fluoridated water, then having additional fluoride, usually prescribed either by the pediatrician or your general dentist or a pediatric dentist, is something that you probably want to do. But I'll talk about why here later. Then you're going to, in your mind, when you're brushing your child's teeth, you want to kind of think like I'm brushing my own teeth. So I usually recommend starting in one spot and moving around, and then do the same pattern every time. So it may be I'm going to start on the upper right, and I'm going to do the outside of all of those teeth. So in your child's mouth, you're going to say, okay, I'm going to start on their upper right-hand side, and I'm going to move all the way around. I'm going to do the outsides of all their teeth. But not just the teeth, brush the gums. I'll talk about that here in a second. When you brush the gums, and especially if you've missed some areas or maybe they've got some tartar there, the gums are going to bleed. If you're brushing your kid's mouth and the gums bleed, don't freak out. So you're not hurting them, you're not damaging anything. The gums bleed because the gums can get irritated, and when gums get irritated, they're not very healthy, and when they're not healthy, they bleed. Healthy gums don't bleed in general. Unhealthy gums bleed. Healthy gums usually don't. But if you see an area that's maybe bleeding when you're brushing their teeth, that should be to you an indicator that maybe I haven't been doing as good a job there. And it's tough because here's what happens in most people's mouths. In my son's mouth, he'll have an area where there's tartar up there and maybe I haven't been doing very well. And so I brush up there and it's a little uncomfortable because the gums are irritated and the gums bleed. I know that, of course, I'm a dentist. I know that the gums are bleeding because I've been doing a very good job. Well, when the gums are irritated and you're brushing up there, it is a little uncomfortable. It's not going to hurt them, but it's a little uncomfortable. So what they do is they start fighting you, and their cheeks or their muscles are really strong, and they start pinching their cheeks in. And so now it's harder to get the toothbrush up there. So now you've got an area where I haven't been brushing very good, and it's now even harder to get up to that area. So it's a tough thing. I've got a couple tips and tricks here to kind of hopefully help you be able to get in those areas a little bit better. But it's a tough thing. You got to brush the gums just as much as the teeth. Really, really, really important. Not just for the cavities, but also for the gum disease. Now, gum disease doesn't happen in kids. We talk about our kids. But as you get older, periodontal disease, gum disease is really prevalent. And you can lose teeth due to periodontal disease. With periodontal disease, we define periodontal disease as the loss of bone around a tooth. So we all have a bunch of bone holding our teeth in our mouth. When you start to lose bone around the teeth, that happens because the bacteria that's in the plaque and in the tartar, when you have that tartar and that plaque and that bacteria, it irritates the gum tissue, which can cause it to bleed. And that's just generally, you've heard of gingivitis. That's what gingivitis is. But if that stuff sits there long enough, there are toxins in that bacteria that the gum tissue and the bone doesn't like. And the bone starts to disintegrate or recede away from that tartar. So now you've got bone that's getting less and less and less and less. And as it gets less and less, the tooth is held in by less bone. Well, that can continue over and over and over again. And over time, you can actually start to get a loose tooth. You lose a tooth because the bone is disintegrated around there. So cleaning the teeth, not just in the home, but getting the teeth cleaned at a dental office is really, really important because you can't brush off that tartar. And the tartar just works its way down along the tooth. So you lose bone, the tartar just keeps growing down. You lose more bone, the tartar just keeps growing down. And it just repeats the process. And once you've gone downhill quite a ways, it's not like you can't stop that, but it's a lot harder to get back where you need to be. So there's a lot of things we're fighting here, especially with the kids because it's, or young adults, anybody with special needs, because it's hard to clean their teeth. Where did I leave off? So, yeah, how to brush. So you're going to start and you're going to go in the same motion. Always start in the same place, into the same place. Brushing the gums. And I always recommend doing that like a routine because sometimes you'll brush over here and then you'll kind of brush over here and you'll go left to right, up to down, and you're kind of going crisscross. Every time you move that brush and reposition to a different area is a really easy way for us to miss a spot where we're brushing. So if you miss, you could clean 90% of the mouth really, really, really well. And if you miss the same spot every time when you're transitioning a toothbrush, that's a spot where you can very easily get a cavity. Diet as well, I'll get back to diet. Brush the tongue. Tongue's not super important, but there is a lot of bacteria that's on the tongue. So, it causes halitosis, bad breath, things like that. So does the bacteria that's on the cheek, on the gums, on the teeth. Like I said, if the gums bleed when you brush, it's not because you did something wrong. It's because that gum tissue is irritated. And brush at least 2 times a day. Morning and evening. It doesn't necessarily mean, it doesn't matter to me usually if it's before breakfast, after breakfast, before you fed them, after you fed them. At night though, it really should be the last thing you do before they go to bed. Definitely after anything they're going to have in there. The last thing you want to do with any child, whether it be a baby, whether it be a toddler, 10-year-old, 12-year-old, 20-year-old, 50-year-old, is you don't want to really eat things that are going to feed that bacteria and then just go to bed. Because that bacteria just got fed, now it's creating acid, and that acid now is just going to sit in your mouth. For people who can chew gum or things like that, chewing a piece of sugar-free gum helps to reduce that acid, but not a lot of our kids are going to be chewing a piece of sugar-free gum after a meal to help reduce acid. So these are those little things that we as an adult might think, hey, we're going to do for ourselves to help our mouth, but with a special needs child, it's just not going to happen very easily. So that bacteria and that acid just sitting on the teeth. And with our kids, when we're talking about diet a little bit, with our kids, the more often we eat, and I think the more often we eat, the more the bacteria grows. The more that bacteria grows, the more acid we have on our teeth. And a lot of our kids tend to snack a lot throughout the day because they don't have these huge meals. You know, we eat 3 square meals. I got breakfast, lunch, and dinner. But a lot of times they're snacking a lot. Every time something goes in the mouth, it's causing that bacteria to grow and causing more acid. And so you have a higher risk of getting more cavities. So different positions that you can do. So a lot of times we think, okay, well, I'm going to brush my teeth in the bathroom. Well, bathroom's great, and some kids may want to see themselves in the mirror. But sit in a chair. So you can have them sit in a chair and you can stand behind them. You can have them in a bean bag. You can have them laying on the floor. You can be on the couch. I'll show you a picture of how I brush Joseph's teeth, which is in none of those positions, although he is on the floor. Well, I'll skip to that one. Hold on, I've got to skip to, okay. So this is how I brush Joseph's teeth. So he lays on the ground. I pin his arms to his side as I straddle him, and I hold his head still. Now, I'm not behind him. As you can tell, I said earlier, you can stand behind your child because it's just too hard for me to kind of hold him and stand behind him. So I'm literally pinning him down. He used to really, really hate this, and he still does sometimes. But for the most part, so I've got toys around. I'm usually singing some type of song as I'm brushing, and usually it's like brush a brush a brush a brush a brush a, you know, brush a brush a brush a brush your teeth, or some others. I mean, and usually I'll say, let's say the toy he was just playing with, he really likes music and sounds and things that light up, and so I'll take the toy that he may have been playing with just right then before we go to bed, and then take that song that the toy was singing and turning it into a brush your teeth song. Now, you don't have to do that, obviously, but for Joseph, that's what works. And many times he'll laugh. Now, in this picture, he wasn't laughing. He wasn't having a bad time at all. But then I have a really good way to keep him still and to brush teeth. And he usually will open quite well for me. Some kids are just going to be like this, and you're never going to get them open. I'm going to go back to a couple slides that talk about that. But for me, at least, he usually opens. He does like to really pinch in those cheeks, so I'm kind of really having to glide that toothbrush out along the cheek, so I'm brushing the sides of the teeth, because the sides of the teeth are super, super important. So are the chewing surfaces. But this is some of the things you have to do. I get asked a lot of times, well, if I really have to fight with my kid, and if I pin them down, I'm going to traumatize them, and they're never going to let me brush their teeth again, whether it be special needs or typical. You're not going to traumatize your kids. They're not going to hate you forever because you pin them down and brush your teeth or brushed their teeth. It'll be okay. They will get used to it over time. It's funny, when it comes to brushing teeth, we're like, oh, I don't want to make them do it, or I don't want to force them to do it, because we force our kids to do all kinds of stuff that they don't like to do. But when it comes to brushing their teeth, it's like, they really don't like me to do it. I'm just going to let them do it on their own and hope they're doing an okay job. It's not good enough with our typical kids, but especially our special needs kids. So this is my technique. Whether it works for you, I don't know. And right now he's 12 and he's not very big. As he gets bigger, it might get harder. His knees are pretty strong, and he sometimes, bucks me forward. You can see his knees are kind of up right underneath my behind. So I have to kind of sit down on him. But he does well, and we do it, all the time, and it works. Sorry, let me go back. So flossing. Flossing's a tough one. I'm talking about brushing, and we talk about flossing a lot because you got to floss between your teeth, which you do. Flossing between our own teeth is hard enough. I mean, how many people floss every day? Come on, raise of hands. Be honest. And you notice I'm not raising my hand. I should floss every day. I don't floss every day. I know better. But we don't. And flossing our kids' teeth, it's hard enough. I don't know how many people. Flossing Joseph's teeth is near impossible. But you can try. Depending on your kid, it's definitely something you should try. It doesn't matter what type of floss. Usually I'm going to recommend something that's really thin and has some type of a coating. There's lots of different coatings they put on flosses to make them slide in between your teeth more easily. And the reason why you're going to need some type of coating is the teeth are going to be really tight together, because we already talked about crowding, and there's going to be a lot of crowding. So you need something that's going to slide in between the teeth fairly easily. So they're generally, all the flosses are going to be very similar. Whatever gets in between the teeth is going to work. You're going to slide it in between the teeth. You're going to get it just to the gum line, and you're going to push that floss against one side of the tooth, and rub it up and down. I always tell my patients it's kind of, the floss is like a squeegee rubbing or wiping the bacteria off of your teeth. So it, yes, does get food debris out from in between your teeth. You know, I got a piece of meat stuck in, or I'll get it out. But the bacteria, if we just get the food out and just go up and down, up and down, up and down, but actually aren't pushing the floss against the side of the tooth, it's not getting all that bacteria off the tooth. And that's why really good proper flossing and using the proper technique takes time and effort, and it's not really easy to do. And so in our own mouths, it's hard, and with a special needs child, it's really, really hard. I don't have really any good suggestions on how to clean in between your child's teeth when they fight you. I don't. There's not some magic tool or tip or trick, but try as best as you can. You're going to go in between each teeth, and also try to remember, if you can, floss behind the back teeth. We don't think about that very much. We think of flossing in between, but you can floss behind the back teeth. And remember, this is all for your mouths too. So I'm kind of doing my oral hygiene instruction I give to patients all the time, but it's primarily because we want to make sure we keep our kids and our kids' mouths clean. Because what happens if our kids, our special needs kids, get a bunch of cavities? They need to be fixed. Well, that makes it harder. It's hard enough for us to brush. They're not going to usually lay down in a dental chair to have things fixed. And if we need to do that and get their teeth fixed, then a lot of times that means they're going to be sedated, or they're going to have to go to the hospital. And how often are we going to put our kids in the hospital to have to fix their teeth? Because there's risks to that. Every time a kid is sedated, there's definitely risks. So flossing, the things, we think of flossing as, you know, wrap the floss around your fingers and get them in there. I would never do that with Joseph. I would lose a finger. I'm sure you guys would too. Well, in his mouth, though, you definitely would. But in your own kids, because I mean, if I just accidentally get a finger in there for whatever reason, he literally is like a pit bull. Like, he bites down, and it's like, I don't know what I'm going to do to get my finger out, and he bites hard. Oh my goodness, it hurts. It hurts really bad. So I would never get my fingers in his mouth. I avoid that at all costs. But you can use flossers. The problem with flossers in some kids' mouth, like Joseph, he's going to bite down on it. And if you have it in between the teeth and then they bite down on one of those flossers, now we just jam that piece of floss in between the teeth and maybe actually damage the gums. So if you have a child that is a biter and grinds or bites or is going to bite on things like that, even tools like this don't help very well, because you know, they could break a piece of plastic. Toothbrushes are really durable. I haven't broken a toothbrush in his mouth, and he just grinds on them like crazy. So you're pretty safe with a toothbrush, but certain things in the mouth could break. But flossers like this can help if your kid is older or they're more cooperative. Definitely flossers like this are going to help really, really well, because you don't have to get fingers in there. It's a lot easier to get that stuff in between the teeth. So tips to help your child. As far as brushing and how long, a timer helps. You can use a timer. We give out sand timers in the office. You know, it's like a 2-minute timer, and you just flip it over, and when the sand is done, you should be over. Obviously, there's a lot more high-tech things than a sand timer. There's cool brushing apps. They have toothbrushes that like sync Bluetooth with your phone. Sonicare makes a kid's brush. It's an electric toothbrush, Sonicare. They make a kid's brush that has an app that knows the position of the brush, and they get rewards for brushing, and that might be great for your kid. So use a timer so they know, so you know you're brushing long enough. But it's not just, okay, 2 minutes and I'm done. It's okay, have I hit every place where I'm going to keep things really, really clean? For sometimes, okay, creating like a schedule for your child. A lot of kids are like, you know, something new or something that they don't realize is coming. So you can do a schedule where, okay, we're going to brush your teeth here in a few minutes. Or, you know, what do we do first? Like, so your nighttime routine, we're going to put on your pajamas. We're going to, you know, if they're not potty trained, we're going to change your diaper. We're going to do these things. We're going to wash your hands, and we're going to brush your teeth. And you can put those things in a schedule, whether it's a picture schedule, whether it's an app. There's several apps that help to set up schedules, or whether you put it on, let's say, their communication device where, okay, we're going to brush teeth. And that will help them hopefully get in the routine of, they know this is coming, not like, why is dad sitting on me and you know, shoving this thing in my mouth. Yeah, so another thing too, a lot of our kids have an oral aversion where they just don't like stuff in their mouth. Many of you may have heard of what's called the Z-Vibe. If you haven't, the Z-Vibe, and I think I've got a picture. Yeah, so the Z-Vibe is this little thing that has these batteries, and it has a bunch of little attachments. So these attachments, speech therapists use them for feeding therapy and things. You can also use it to try to get your child used to having something in their mouth. And it vibrates. So that vibration, and the theory is that that vibration helps to stimulate the muscles and to normalize the sensitivities that are in the mouth. So from the Z-Vibe website, it says it's a vibratory tool for oral motor therapy used to normalize sensitivities and to improve a variety of speech and feeding skills. Recommended for individuals with low oral tone, oral defensiveness, and or texture aversions who need sensory oral motor stimulation, which a lot of our kids, we used the Z-Vibe when Joseph was little, and he didn't like it very much, kind of like he doesn't like me brushing his teeth, but it did help. And if you're curious about a Z-Vibe, or your kid has feeding issues, things like that, or at home, and you can buy them on Amazon. I mean, you can buy them in lots of places. Not like it's kind of expensive, although it's not too bad. And you can find them pretty easily. So you can look up Z-Vibe. They have like instructions on how to use it and different tips, and there's videos of people showing you how to use them. But it can help because it's this other thing that you're not brushing the teeth, but it vibrates, and you can slide it in between the cheek and the teeth. You can slide it under the tongue, on the tongue, things like that, to get them used to things in their mouth, especially things that are moving. And they have the different tips to give different textures and things as they're using it. You could try an electric toothbrush. Manual toothbrushes are great. Electric toothbrushes are great. For some people, an electric toothbrush is just too much stimulation. The two main brands are going to be Oral-B or Sonicare. Both are great. Both work different. The Oral-B oscillates back and forth like this. The Sonicare flaps back and forth really, really fast. But for some kids, it's going to be too much stimulation. For some kids, they may like that stimulation, and they may like the movement in their mouth. And trust me, it does make it much easier for a parent or an adult or a caregiver to brush teeth with an electric toothbrush, because you don't have to move back and forth. You hold that toothbrush where it needs to be, and you move it slowly around the teeth, and it's doing all the work. So if you can use one, I would suggest using one, unless they're going to bite it and destroy it, or there's just too much vibration and it's overstimulating for them. As your kid gets older and it's easier to transition to something like that, an electric toothbrush would be something I'd probably look into. I always recommend you do not have to spend $150, $200 on an electric toothbrush, and they sell them that are that expensive. Both Oral-B and Sonicare make a really good, fairly inexpensive electric toothbrush that has a rechargeable base that is, in my opinion, just as good, if not 90% as good as their $150. I must not be plugged in. Hold on one second. There we go. Power strip wasn't plugged in. But they make inexpensive electric toothbrushes that run $35 or so, that work really, really well. That's what I sell in my office, because I want people to get and use an electric toothbrush, and they don't have to spend so much money on one. The Oral-B, I don't remember the names, but just when you go to the store or Amazon or whatever, it's the inexpensive one. I would stay away from battery-powered ones. The problem with battery-powered ones is the batteries run out. You keep having to replace the batteries, and as the batteries run down, the power gets less. And so you could be thinking you're doing a good job with the electric toothbrush, and it seems like it's doing its thing, but it's not, because as the batteries run down, it gets slower, it has less power. And so generally the rechargeable ones are much, much better, because it's always on the charger, it's always ready to go, and the way they generally work is it's at pretty good full power until it really, really, really runs down, which would be like a week of not being on the charger typically. So another tip or trick to help get in the mouth, and for a lot of kids, I've used this on Joseph but haven't had to a lot, is to use some type of a mouth rest. So the best one that I've seen is called the open wide mouth rest, and it looks like this. It's this foam wedge shape thing that you can see her using it. And so that's actually a really good example of someone standing behind someone, and that person's probably in a wheelchair or sitting in a chair, and the caregiver is standing behind them, and it's a foam, it's basically like a tongue depressor, a wooden flat stick that's wrapped in this dense foam. They make two different types. They have a regular and then they have a thick. And depending on how strong your child's bite is or how you need to use it, the thick may be better to use because it is just foam and wood, so they can destroy it. You can use them over and over again, but eventually it'll wear out and you'd have to buy some more. You can get these on Amazon. You can get them from their website. If you just look up open wide mouth rest, you can find those. They come individually. They sell them to dental offices. I found them honestly first because I have a friend who's a pediatric dentist, and they keep them in their office and they use it a lot when they have kids who have either a hard time holding open because they have to be open for a long time, or B, they don't want to open like our kids, and so it works really, really well. It's reinforced, like I said, with a rigid wooden core. They're not cheap, but they're not expensive, especially when you can use them over and over again. But you can also, a couple things that you can use, you could take a couple tongue depressors and wrap them in tape. It's going to do the same thing. You wrap them in tape or fabric or something, and you can slide it in between the teeth. I'll show you kind of a little bit. You saw on that other slide. But another thing you can use is like a rolled up moistened washcloth. So that they can bite down on. The hard part is getting the washcloth in between. The open wide mouth rest is really nice because as soon as they open for whatever reason, you can slide it in there flat ways, and then you turn it vertical. And it will, even if they're biting down, you can kind of turn it vertically, and then you can slowly slide it back. Because usually our kids, once you get something in between the teeth, they want to chew on it. So to chew on it, you got to open then close. So they open, and you slide it back a little bit more. So now they're there. So now they're stuck. They aren't going to like it. It's not going to hurt them, though. It's foam. You're not going to do any damage. But again, they may not like it, but it's a good way to get in there. Now, once they get used to it, they'll probably go ahead and be okay with it. So that's kind of how it would be in there. And you're going to position it in two different ways. So in this instance, they're going to be brushing one side of the mouth and probably the front teeth. But obviously, you aren't going to be able to brush the teeth that they're biting on. So eventually, you're going to have to switch it to the other side and brush the teeth on the other side. But it's a really good, safe way to get in there so you don't get bit and you can get to where you need to do or where you need to be. The other nice thing is you can use it as a cheek retractor. You can put it in between the teeth and gums, and you can kind of, it's stiff enough that you can move their cheek out of the way, usually unless they're really, really fighting you. So I talked a lot about teeth and cleaning and what you want to do to keep everything clean and how to do it, maybe some tips and tricks to do it. The next thing is a lot of people are like, well, I can't find somebody to see my kid, or it's really hard. And it is. The smaller the area, the harder it's going to be because your choices are fewer. The larger the area, it might be easier. But even then, it's not that easy. I've talked to a lot of people over the years that they may live in a major metropolitan area, but they have a really, really hard time finding somebody who is patient enough to work with their kid, maybe has experience working with special needs kids, and an office that they feel comfortable in, because you need kind of all of those things. So you want to find a dentist who works successfully with individuals with special needs. Now, it doesn't necessarily have to be somebody who has worked with a lot of special needs kids. They may have only worked with a few, but they may have worked with the same few over their lifetime. So they may have saw, Susie or whoever when they started at maybe 2, and they saw them till they were 16 or 18, and maybe they moved away or something. Now, they may only seen a couple kids like that, but they've had a lot of experience over the years. A pediatric dentist, especially for the younger kids, is probably the first way or the first thing I would look at. Pediatric dentists have gone to school after dental school to learn more about how to treat kids, but they're also going to have more training in special needs kids. They're going to have more training in sedation, and just in general more training on more difficult cases. Your average general dentist really doesn't like to see kids. A lot do. Love kids. I have a ton of kids in my office that I would probably rather see than a lot of my adult patients, because kids can be fantastic. They're like, oh yeah, they open up and they do great, and adults just complain and whine, and not all the time, but there are many times I would much rather see some of my kids who are just perfect little patients than a lot of my adult patients. But in general, a lot of general dentists, which I am just a general dentist, a lot of general dentists, they just don't feel comfortable treating as many kids, and they definitely may not feel comfortable treating special needs kids, primarily because of experience. In dental school, we did not get any specific training on treating special needs kids. A little bit of just in a lecture here and there, but very, very little. So it's their comfort level or what other additional training they've had. The best way is to, one would be I would look for a pediatric dentist if there's one in your area. In many communities, there may not be a pediatric dentist. There may be the local general dentist who sees most of the kids, but I'd look for a pediatric dentist. You don't have to. General dentists can do a fantastic job. Ask friends and family, at least who maybe they see, or your own dentist. Talk to that dentist. So I used to say, if you don't know who to contact or who to go to, and your own general dentist, or maybe you don't have a general dentist, which you should, but if you don't have your own general dentist, you need to ask friends or family. You can also maybe contact a local disability nonprofits, or potentially the schools, to see maybe if they've heard of different individuals, different dentists throughout the community who may do a pretty good job at treating special needs kids. You might call the local dental society. There's always typically a dental society locally. There's the American Dental Association, then there's usually a state dental association, and then there's usually what they're called component societies, which will be a community or several local communities where the dentist will meet usually quarterly or things like that. But there will be a dental society, and you can find that number usually by contacting like the state organization. So in Oregon, which it was where I live, in Oregon it's the Oregon Dental Association. Here in Texas it's probably the Texas Dental Association. There's probably a local society here in Houston. When you find somebody, or if you're just trying to find somebody, call the office and ask a lot of questions. If you can, ask to speak with the dentist. And if the receptionist says no, you might want to move on. Because what you should do is call that office and say, okay, here's the situation. I have a child with special needs. These are some of their issues. Is Dr. So-and-so here, is Dr. So-and-so, have they treated a lot of special needs kids? Do they feel comfortable treating special needs kids? Or what do they typically do? Now, some general dentists will say, I always refer those out. Oh, it's Dr. So-and-so always refers to this pediatric dentist, or maybe another dentist. So, you want to see if that person that you call or that office, if you get a good response from the person answering the phone. If you can, ask to speak with a dentist. And I always think that if the dentist is not willing to speak with the parent who has questions, maybe you want to call somebody else, because you're going to have a relationship hopefully with this person throughout your child's lifetime, and that person can help you with their care. Even if they may not be the person actually doing the care, they can help coordinate where that care is going to be done, whether it's a specialist or not. Let the office know, let's say you found this dentist. Okay, well, if your child typically has a good time of day, my kid's really good right after lunch, and 2 o'clock, let's say, is like they're doing great, then I would say always tell them that. My kid's good at 2 o'clock. Please schedule them at 2 o'clock. And if they said, no, we can't see them at 2, sorry, our schedule just doesn't work that way, probably not for you. Or maybe your kid is better in the morning. Whatever it may be, always request. When your kid's doing good, that's where you should go ahead and want to request to schedule the patient. Describe the concerns and challenges that your kid's going to have, so that they know what to expect. A lot of times you can start with a kind of a get-to-know-you office visit, so where they come in and you just go in and meet everybody. You don't do anything. Kid comes in, maybe they're in the wheelchair, maybe they walk in, whatever it may be, and maybe they just sit on your lap in the dental chair. But it's kind of to get a feel for the office so they know what coming to the office is. You don't really do anything at all. Maybe they look at a mirror, maybe they brush their teeth just a little bit, but that's it. You don't have to do a whole lot. You want an office that is going to hopefully work with you and be patient with you as best as you can. So when you prepare for the dental visit, Again, you can try to do that visual schedule. Hey, here's what's going to happen at the dental visit today. And depending on the age of your child, they may or may not get that. But as your child gets older, getting them used to what's going to happen when they're there is a good thing. They're going to have to keep their hands down. They're going to be laying down in kind of a chair, kind of in a recliner. They're going to have to open wide. They're going to have to, hold their mouth open. And the dentist or the hygienist or the assistant's going to count the teeth, and they're going to maybe get a cleaning with kind of a power brush. So they get used to these different things that may happen at the dental office. And then you can try the steps at home. So, okay, if you have a recliner at home, you go, okay, well, this is how it's going to be when you're at the dental office. You're going to be laying in a recliner. You can get like a small flashlight at the store and say, okay, and shine the flashlight in your child's mouth or face. Okay, the light's going to go on your face like this. You can buy cheap dental mirrors, so you at least could show them how that mirror is going to go in the mouth. And again, just brushing the teeth, or like you can get what's called a rubber tip gum stimulator, which you can use to kind of push along the gum tissue. It kind of looks like a thin rubber Hershey's Kiss on the end, and that can help to stimulate the gums, but also just get them used to having things pressing on their gum tissue or on their teeth. You should know and keep, just like your medical records, you should know and keep the dental records. So let's say you've moved, let's say you're going to a different dentist. You should be able to know what's been done in the past, and a record of what kind of happens and how it goes. So maybe they forget, or maybe it's been a while since you've taken your child in. You should say, hey, well, last time they had their teeth cleaned, they didn't do very well, and I think this is why, so maybe we could do something different. So give suggestions and be able to remind the office what tended to work and what tended to not work the time in the past. Always have your medical history. Thankfully in dentistry, there's not a lot of things we do that cause medical issues to be worse, but we are putting things in the mouth. A lot of our kids have seizures. We're definitely going to want to know that, because if they are having a seizure in the chair, we want to get things out of their mouth. I mean, it would be a dangerous situation. So we want to know, like with seizures, I'm always asking, is there something that you see or you anticipate, or maybe you see in your child right before it happens? And this kind of leads into, and I may have it on another slide, a lot of times I get asked, well, my dentist won't let me go in the back. In where they need, the parent in the waiting room, and they just don't allow the parent in the treatment room. My opinion is, I don't think there's any reason why a parent can't be in the back. In many instances, especially with our kids, it's going to be more beneficial than harmful. Now, with a typical kid, there are many times I wish the parent would stay out in the waiting room, because you get through, oh, it's okay, that shot's not going to hurt. It's like, well, the kid didn't know I was giving him a shot, and I probably could give him a shot without him knowing, but now you just warned them that something's going to hurt. So now they're freaked out all of a sudden. So some parents, sometimes it can be detrimental, but for like our kids, I would say if you want to go in the back, really they probably ought to let you go in the back. They don't have to. Many offices have a policy where they just don't allow parents in the back. And if that's okay with you and you trust that dentist and the staff, that may work perfect for you guys. But if it's a time, and this is more talking about like cleanings and things like that, if there's like a lot of sedation or they're doing a bunch of stuff, it could be where the parent would be in the way. But I think my opinion is a parent should be able to go in the back, and in my office I'm completely fine with that. And with our kids, I think it would probably be something that would be beneficial, because you can help. And when it comes to seizures, let's say you see something, you're like, hey, we need to stop. Or you can read what's going on with your child, and you can help them manage the behavior some. Bring all insurance, billing, and legal information, all that kind of stuff. And most important, be on time. But you're going to let them know, hey, Susie, Johnny, they take a lot longer to work on, so can you schedule a little bit of extra time? But be on time. Now, I say that in my office, I try really, really, really hard to be on time. And I usually am, thankfully. But there's some offices where people are constantly running behind. And some people, because the office is always running behind, they'll show up at the appointment a little bit late because they know they're going to have to wait there for forever. That's a tough one, but I would probably say, hey, when is Dr. So-and-so the most on time? And they may say, well, actually, usually in the morning's better because he hasn't had as much time to get behind, or maybe it's right after lunch because they've just come back from lunch and they kind of start fresh again. Or just find a dentist or ask them, does Dr. Shirtcliff run on time a lot? Because I can't really sit in the waiting room for half an hour with my child, because as they start to melt down here, by the time I get back to the dental chair, they're definitely not going to be having any fun, and we're not going to get anything accomplished. But you want to communicate really, really well with that office, because if they don't know and they typically run behind and you haven't said, hey, that's just not going to work for me, then we're setting ourselves up for failure. So again, what if my child just can't cooperate? So a lot of times you say, well, my kid at a regular office without pharmaceutical help just cannot, just can't do it. Then it's, one, especially important to have good home care from the early, as soon as those teeth come in. Fluoride, again, I was talking about fluoride. Fluoride, what it does, you can use it both internally and externally. So when we think of fluoride in general, we think of fluoride in toothpastes. And fluoride in toothpastes help to microscopically harden the very, very outer surface of the enamel. Then there's fluoride that we ingest. So fluoride in water, fluoride in supplements, fluoride maybe we swallow in the toothpaste. That fluoride, when we are developing teeth, that fluoride gets incorporated into the teeth as they grow and makes those teeth harder. Studies have shown that over and over and over again. I won't even go into the controversies of fluoride, because from a scientific standpoint, I just don't really think they exist, but I won't get into that. But fluoride in proper amounts works really well to prevent cavities. It makes the teeth harder, and I would always recommend start your kid on fluoride from like 6 months on. Those teeth are developing, those adult teeth are developing from that early on, and you just want to get fluoride to the teeth. You guys may have heard of, I call it xylitol. I guess technically it's xylitol. But xylitol is a naturally occurring substance found in many fruits and vegetables that can reduce decay if the person gets enough of it in their mouth on a daily basis. Xylitol, essentially think of it as, it's called an alcohol sugar. So you've heard of like mannitol, sorbitol, some of the sweeteners that they put in sugar-free gums. Xylitol is kind of like that, but xylitol, the bacteria not only doesn't like, they can't use it and they don't grow as much. And xylitol has been shown, if you get enough, to reduce decay in someone's mouth. It's also been shown to reduce ear infections. So sometimes you can get prescribed from your pediatrician to have xylitol-like drops in the mouth to help reduce ear infections. It'll also help reduce the chance of decay. You have to have enough of it, and your dentist or your pediatrician will make sure that happens. Like any of the artificial sugars, it can, if you get too much of it, cause diarrhea or kind of the runs, because your body can't digest it either. So things kind of flow a little bit differently. Now, I don't think really, honestly, in our kids that typically are stopped up a little bit more and deal with more constipation issues than a lot of people, I don't think it's probably going to be an issue. And a lot of those studies show that once your body's used to that, then that issue goes away. But you'd have to have a lot more than the typical dose. But xylitol is not something in too much that's going to harm or hurt anything. The big thing that I'll talk about is silver diamine fluoride. So silver fluoride is a brand new thing that has been around for a very long time that can stop and arrest decay. So you can have a cavity on a tooth that is growing, and you can place silver fluoride on that tooth, and it will make the cavity stop growing, and it will stop the bacteria from creating more of a cavity. I use it in my office for both kids and adults. Ask your dentist about it. It is really a hot topic in dentistry. It's the new kind of big thing. Now, I will say it is a new big thing, but it is not the new big thing for everything, for everybody. And the reason being is because of this. So, this is a bunch of cavities. You can see right here. This is what the cavities look like after you put silver fluoride on them. And the teeth will stay looking like that until they fall out, or until you put a filling in there. So the one huge drawback is it stains the cavities. Now you'll notice it doesn't stain the good part of the teeth, but it stains the cavities. And so silver fluoride is one of these things that I would rather make a kid look like this, then sedate them over and over again. Because sedation can be dangerous, especially with special needs kids that have special issues. It's the one main drawback. They're working on ways to get around the staining, or to get the person old enough and cooperative enough to make it easier to put a filling in there. Now, that's front teeth. Back teeth you're probably not going to see. In fact, the darkness kind of almost looks like they've had a metal filling placed on the teeth. But that is the one main drawback to silver fluoride. But silver fluoride, like I said, in dentistry is the hot topic. It is now being taught in dental schools. It is now being, I think, a majority of pediatric dentists are using it, but it's only been used for probably 2 to 3 years in the United States. What's interesting is silver fluoride started out as they were using silver nitrate. A lot of you may have heard of silver nitrate if you've had a button that used silver nitrate to cauterize bleeding, to get rid of granulation tissue and different things. But silver fluoride, or silver nitrate in a lower amount does the same thing as silver fluoride, but silver fluoride just does it better. I'll go back to silver fluoride. So I was saying, what happens if your kid just can't cooperate? Well, silver fluoride's a wonderful one, because if your child can't cooperate and they have cavities, one, bacteria, what the studies show is that if you get silver fluoride on the teeth and get silver fluoride on a cavity, it reduces the bacteria not only on that cavity, but on the teeth next to it. And if you put it on all the teeth, it can reduce cavities on all the teeth. The silver ions, they think at this point, the theory is that the silver ions get embedded into the enamel. So then the other option is hospital dentistry or some type of IV sedation. If your kid's really young, they're going to take them to the hospital. That's the only way to do it. They're just not going to be able to get things fixed in an office, and they're not going to feel safe doing it unless they take them to the hospital. If hospital dentistry has to be done, I usually recommend doing it and combining it with something else. So if your kid needs ear tubes, your kid needs some other procedure done that you know is coming up in a few months, see if you can coordinate it. That sometimes is really, really hard depending on the hospital, depending on how those doctors decide they want to work together. But if your kid only has to be sedated for a little bit longer, but once, it would be better than being sedated for a short period of time over a long period of time. But sedation is sometimes the only option. But that's where silver fluoride is nice, because silver fluoride, it's really quick and it's really easy. And it tastes kind of funky, kind of has a metallic taste a little bit, but it's not going to hurt anything. It's not dangerous. There's not been one adverse reaction really ever shown from silver fluoride, and they've been using it in other countries for a long time. They've done a lot of research, and they're doing a ton of research right now. There's millions and millions of dollars being put into silver fluoride research right now. But it's safe and effective. It's quick and easy to apply. It's inexpensive. I mean, for a dentist to buy, it's super inexpensive. I, a lot of times, don't even charge people when I'm doing it. If I'm in there for something else, or we'll just combine it with the cleaning, I think literally I buy a bottle of the stuff for like $100, but there's probably over 100 applications. So maybe it's $1 worth of stuff that I'm using. It's in a couple drops. And the early studies are really showing that it helps prevent decay. And in some of them, like you see on the top, it can stop up to between 47 and 90% of lesions within one application. So a lesion is a cavity. And if it's not too deep and you can get that silver fluoride on the entire cavity, it can stop it dead in its tracks. And it will not get any bigger. And the tooth actually kind of even feels different. That decay, usually it's leathery and sticky, it'll feel hard, but it'll look black. It's the one thing that we'll have to try to work on here over the next few years, see if we can make that go away. But if your kid can't cooperate and you don't want them to have, they've got decay and you don't want to sedate them, or maybe you're not going to sedate them yet, maybe they got procedure coming up in 6 months, but you really want to get this cavity arrested, then silver fluoride would be a really, really, really wonderful way to try to do that. But again, the main drawback is aesthetics. A lot of times I get asked about teeth grinding. I know teeth grinding comes up a lot on the Facebook group. Teeth grinding in our kids is really common. Teeth grinding in a lot of kids is really common. It is a hard thing to get around. If you're grinding your teeth as an adult, I'm going to say, hey, let's make a night guard. And you can wear a night guard while you sleep at night, because that's usually when the grinding happens, and it'll take care of the problem. You won't grind your teeth down. You'll grind down the plastic that's a night guard. But obviously in a child, you can't you can't wear a night guard. You can't make it, one, their mouth is growing, they're not going to wear it. You don't want to, to destroy it. And it just doesn't quite happen. So a lot of times you use the different things like chewy tubes, jewelry, P's and Q's. I see a lot of kids, have that kind of stuff around their neck, something for them to chew on. But there's no magic, hey, if you do this, my kid will stop grinding their teeth, especially at night. If your kid's grinding their teeth at night, they're going to grind their teeth at night. And it's going to sound horrible, and they're going to wear down their teeth. But right now, at this point, especially for kids, because their mouth is changing so much, or special needs kids, because you don't want anything that they could choke on, aspirate, whatever, especially while they're sleeping, there's not a magic thing that we can use. But during the day, if they chew on things a lot, chewing on something that's not going to harm their teeth or damage your mouth is really important. All of these different things you can find really easily on Amazon or other websites. There are websites specifically, special needs websites, a lot of them sell this type of stuff, and it works pretty well. So again, there's that picture of the silver fluoride. And I guess that's really it. So that's my email address. That's my 1P36 email address, my president email address, and the bottom one is my office email address. And the office email address, that one just goes directly to me, so I would read it. So if you have questions, either dental or 1P36 deletion support and awareness, email me. If it's, I won't say you have to pick one email and say if it's a dental question due to my dental address. Either one works just fine, but I get both of those and read both of those all the time. If you have a couple questions, we're going to break. In fact, probably I'll stop right now, and if you have dental questions, I can answer those questions this afternoon as well, or just come up to me later. But most dental questions are good ones that you can ask and let the whole group. But if you have a specific dental question about your kid, let me know. Obviously, I'm here. So we'll go ahead and take a break. If you haven't got your kid out of childcare, go ahead and get them out of childcare. Sounds like Danny has a couple announcements.
So definitely thank you, Ken, for doing that. So these doors right here are going to be locked. They set up the food right outside these doors, so if y'all could use the back two sets of doors until they get wrapped up, it'd be great. Appreciate it. Thank you. These two sets I've locked, yeah.
Those 2 sets are good.
Yes.
Yes.
Is it okay to take your adult to a pediatrician?
Is it okay if you take an adult to a pediatrician? Yes. Some pediatricians continue to see kids with special needs into adulthood and throughout their life. And many pediatricians will do that. That's just part of what they do, and they will. Some don't. Some will have a certain age limit, and let's say that's 16, maybe it's 18. Usually it's through high school age that a lot of pediatricians, some pediatricians, depending on the pediatrician, or not pediatrician, excuse me, pediatric dentist, some pediatric dentists will have an age limit of like 12, where they're like, hey, after they're 12, they need to go to the general dentist. But most pediatric dentists will see at least through high school, but many of them will, especially with kids with different special needs, will continue to see that patient throughout their lifetime. And they really enjoy it, because they've seen that kid throughout their life, and they will just continue the care. And honestly, once you reach high school, you're pretty much how you're going to be from an age or a size aspect. So if they've seen you at 18, what's the difference at seeing you at 30? At least that's my thoughts. And a lot of times the reason why that needs to happen is if your child needs to be sedated. Pediatric dentists, almost all of them will have hospital privileges. Not very many general dentists do. So if your child or your young adult has to be sedated for dentistry, then they will have hospital privileges. Otherwise, if you've got an adult that needs to be sedated, besides just what they would feel comfortable doing, what's called IV sedation in an office, you would need to find a general dentist who has hospital privileges. And depending on the area you live in, that may not happen, because it's not the easiest. There's a lot of politics and hospital privileges between the different specialties, and it can be harder to do. But to answer your question, yes, many pediatric dentists will see kids through adulthood, especially if they have special needs. Yeah. Another question, yes. Oh, so the question is about a water pick. So a water pick can work great. My personal opinion about a water pick is, my analogy is like a brushless car wash. So if you've ever taken your car through one of the brushless car washes where it just like power washes it, it still leaves a minute film on the teeth. So that film is kind of like the plaque that's on your teeth. It works really good to get chunks of food, debris, and the big stuff off. It can help stimulate the gums really, really well, and it can help get bacteria out from underneath the gums if you use it properly. But I always say a water pick it's a supplement to one of the tools you would use in your mouth or your child's mouth, but it is not a replacement for your main things. Now, if you said, okay, well, I brush really well and I can't do any flossing, a water pick would be a wonderful thing to use because it's going to help get some of that bacteria and food debris from in between the teeth. And your kid may like it, or they may feel like they're drowning. Never turn a water pick all the way up. These usually have like 0 to 10, have it a lot slower. And you always want to push it across the teeth, never straight down into the gum tissue. And those instructions are with the water picks, but water picks can be very, very, very good. Yeah. One more in the back. Bo has one. Oh, yes. I should have put yes. And that was just somebody just like on the Facebook group. So Bo was asking about, well, what about the teeth and when you can't find them? Did they swallow them? Where did they go? What happened to them? If they swallow them, that's fine, more than likely. Is there a risk that maybe they could have aspirated a tooth? Yes. If they did, you would know it fairly soon because they would start to become sick. And if you're like, hey, they just lost a tooth, it's 2 days later and they start to get really, really sick, especially they have a hard time breathing, they're coughing more, you're going to take them to the doctor and they're going to want to take an x-ray to see if they can see a tooth in the lungs. That does not happen very often. I know that's kind of scary, but it does not happen very often. Most kids, they will either swallow them, or more than likely, it just is gone, and you will find it next year. Joseph loses his teeth all the time. He'll go from having a tooth, I mean, my wife Carmela is a dentist as well. I didn't say that. She could have given this presentation also. So we're both dentists. And we're both dentists. We look at his teeth all the time. He'll go from having a tooth that doesn't seem loose to all of a sudden he's bleeding, and I'm like, there's a tooth gone. And then I'll be like cleaning up his room, picking up a toy, and I find the tooth on the carpet. We found actually for Joseph most of his teeth, but if you can't find them, it's okay. If they swallowed them and it's been like 2 weeks and they're fine, they're fine. Swallowing, it's not going to probably cause any issues. They're pretty small, especially baby teeth, so it's usually typically not an issue to swallow them. Sometimes, though, they will come out in pieces. I had a patient once that she was deaf and she was blind and she was a lot worse off than most of our kids. But her mom would bring her in. We'd just have her come in whenever you want. And there'd be like a piece of tooth that was coming loose, and she would allow me just enough to grab a hold of that little piece. We'd pop whatever little piece off the gum tissue that was stuck, and then they'd go. It might be a couple weeks later. We'd have her come back in. We'd take a couple other little pieces out. Sometimes you can do that really easily without too much trauma, and they won't mind too much.